Hello and welcome to GBNews Originals. I'm Miriam Cates. Now, the question of how to pay for the costs of social care for elderly people is one that has plagued all governments in recent times. Now, everyone agrees that the system just isn't working. But today, the government has announced that it will delay important social care reforms for another 3 years. And this move has been heavily criticised by the care sector itself. We all know someone who has needed social care, maybe a grandparent, an elderly parent. It might be that they need help getting out of bed or taking medications or cooking food. But the current system is a total lottery. Some people find excellent and reliable carers really quickly. Other people struggle to find anyone at all. And of course, there's a perpetual shortage of care workers, partly because they're paid less than jobs that are much less demanding, such as retail or warehouse work. There's also lots of confusion about who pays for social care and how much it costs. Many people still believe that adult social care is free and covered by their national insurance payment. But this isn't true. Paying national insurance during your working life does qualify you for NHS care and a state pension, but it has never and was never intended to pay for social care. Now, some people will go through their whole lives and their death without any need for social care, but others will incur costs of tens of thousands of pounds. And at the moment, anyone with assets of less than £23,000 has their care costs covered in full. But those with additional savings have to pay the full cost. 2 years in a nursing home could cost you well over £200,000. So there's this real sense of unfairness. People who have worked hard and saved during their working lives can lose huge sums of money in care costs, while other people who haven't saved money can have the full costs of their care paid for by the taxpayer.
Proposals for the long-term funding and major reform of social care in England aren't going to be on the table until 2028, we understand. The boss of Care England says this is not an option. People in care today cannot afford to wait any longer. Their lives depend on action now. Why is it taking so long?
Well, of course, that criticism would be fair if we weren't already acting now. So there's two things going on here, Stephen. Firstly, we have announced today that there will be an independent commission into social care led by Baroness Louise Casey, who is, I would argue, the foremost public sector reformer of our time. And she will be tasked with looking at what the shape of a social care system, not just for the next few years or the next decade or so, but for the next several decades should look like, drawing on the experience of those that operate social care services, those that receive social care services, and the vast army of unpaid carers as well. But look, we've got to go further with this. We've got to build in political consensus, and that's why we have written to the opposition parties to invite them to take part in this commission with Baroness Casey, because, look, we recognise the kind of changes that we are going to need, the kind of reforms we are going to need for our social care system for the future requires this change lasting more than the lifetime of this government, going into several governments. And we've got to learn lessons from the past to draw that sting out of social care politically, because no political party has good form on this. When Gordon Brown tried to reform social care in 2010, Andrew Lansley of the Conservatives denounced it as Labour's death tax. When Theresa May tried it in 2017, we lambasted it as Theresa May's dementia tax. We've got to go beyond that. We've got to come up with a roadmap for delivery, and one that will survive this Labour government.
Now, the last government brought forward plans to cap care costs at £83,000 per person and to raise the asset threshold to £100,000. Now, this would have meant that however much care you needed and however much money you had or didn't have to start with, you would not have to pay more than £83,000 in total on your care. And it also would mean that your family would not be left with less than £100,000 to inherit on your death. Now, these reforms would not have solved the two main issues with social care, lack of staff and not enough money in the system. But many agreed that they would have made the system fairer. But of course, the government have now scrapped these reforms. So how do we solve the problem? Well, on the face of it, the crisis in social care is mainly a question of money. Councils report that they need billions of pounds more from the government each year to cover the costs of adult social care. And indeed, many local authorities are facing bankruptcy as a direct result of the costs of social care. But the social care crisis has not really been driven by cuts. The UK now spends £28 billion a year on care, which is a rise of £2 billion from just 15 years ago. Rather, the problems are being caused by three significant changes in society. The first change is life expectancy. When the NHS first came into being in the 1940s, life expectancy was around 65. So very few people lived long enough to require long-term care. And people tended to die after shorter illnesses or things such as heart disease, rather than live for years with disabilities that require constant care, such as dementia. But life expectancy now in the UK is 81. This is a huge success in terms of people's health and their longevity. But it very obviously means that there are far more elderly people alive today than at any previous time in our history. And therefore, of course, there are many, many more people requiring care. The second major change is that the number of children people tend to have has gone down. In the 1960s, the average woman had just under 3 children. But this number has halved and it's falling fast. That means that there just are far fewer children and grandchildren to look after the elderly, and proportionally fewer working age people to pay tax to cover the costs of pension and care. So when I was born in the early 80s, there were 4 working age people for every pensioner. Now there are 3 working age people for every pensioner. By the end of my lifetime, there will be 2 working age people supporting every pensioner. Now that statistic alone explains why there is such a shortage of both money and carers. But there's been a third change too. In previous generations, many women didn't work outside the home and they cared for both young children and elderly relatives at home at no cost to the state. This is no longer the case for a whole variety of reasons. So a job that was previously done by family for love now has to be done by the state at a cost. Now, none of these changes are good or bad in themselves, but together they've created a really complex problem with no easy solution. How and who should pay for the mounting costs of social care, costs that are set to double in just 20 years? Of course there's a limit to how much money the government can put in. There's no such thing as government money anyway, just taxpayer money. And as we all know, taxation is at its highest level ever. It's not right or possible to squeeze any more money out of working age people, especially when so many older people are lucky enough to own assets in the form of housing, something that is now increasingly out of reach to anyone under 40. Nevertheless, any short-term solution is going to have to involve a cash injection. But for a long-term solution, this is a problem that lends itself perfectly to some sort of insurance. Just like car insurance or home insurance, you hope that you'll never need it, which is why the costs are affordable. Now, we could have something similar for social care insurance. Pay a small amount each month throughout your working life and then have your care costs covered in full, should you be unlucky enough to need them in your elderly years. But this alone will not solve the problem. If we really care about good care in old age, if we want old people to be treated with dignity, to be loved and looked after tenderly, then we just need bigger families and more working age people. That means having more children. There really is no other way to solve this problem. This is Miriam Cates for GB News. Don't forget to subscribe to our channel for more originals content.